Hi everybody, I want to talk about my knee injury. I got an MRI and talked to the doctor. I want to talk to you about that and get your feedback. What should I do next? So I injured my knee last summer playing soccer, running flat out, kicked the ball, landed kind of straight legged, instant pain, was swollen for like a week and a lot of pain, didn't move very much, sat on the couch for like a week, started getting better, the swelling went down, went to physio. There's clicking after the swelling went down, so that indicated some sort of meniscus issue. So I got this MRI just the other day, picked up the CD and got the images here. And so here's what they said the MRI showed. The impression: tears of lateral meniscal posterior horn and root as described in the larger description. No parameniscal cyst. Osteochondral injury involving the mid-posterior lateral tibial plateau. So here's the tears. Tear in lateral meniscus, posterior horn, and root. I guess that would be it, and this would be it. I don't know. I'm not an expert. I'm just looking at it. So this is this is the lateral side. We're kind of looking from the bottom of my right leg, I think, if I'm reading it right. See, there's the tibia. I don't know what that tibia. So that's the meniscal stuff, and you can see the cut line moving. I'll zoom in. Now, when I go for longer walks or something, I also get aching behind kind of my kneecap. So I don't know if it's only this lateral meniscal posterior horn tear and osteochondral tibial lateral tibial plateau injury. So I'll just go ahead and read the entire findings that the person that analyzed the MRI wrote up. So he says there's a significant pulsation artifact at the level of the intercondylar notch. I guess that just means the image is messed up there. The medial meniscus is intact. There is a radial tear involving the free margin of the lateral meniscal posterior horn. There's an oblique tear involving the lateral meniscal posterior root, which surfaces superiorly, resulting in a small posteriorly displaced attached meniscal fragment. No parameniscal cyst is identified. Allowing for artifact in sagittal sequences, the ACL is intact, the PCL is intact, the cruciate ligaments, biceps, femoris tendon, popliteus tendon, and anserinus tendon are normal. The extensor mechanism is normal. Trace joint fluid is identified. The popliteal fossa soft tissues are within normal limits. A small osteochondral injury is identified in the mid-posterior aspect of the lateral tibial plateau, consisting of a shallow 8 mm concave defect, the subchondral bone marrow edema, and overlying articular cartilage irregularity. No discrete loose body is identified in this location. Full thickness articular cartilage fissuring or subchondral cyst formation is identified. That sentence is kind of a run-on, but I think they're just saying that no discrete loose body and no articular cartilage fissuring or subchondral cyst. So that's the whole findings. This is a 1.5 Tesla MRI, if that matters. And I got axial, coronal, sagittal, coronal, well, let me say, axial PDFS, whatever that means, coronal PDFS, sagittal PDFS, coronal T1, sagittal oblique T2 sequences obtained through right knee joint at 1.5 Tesla. So I got 3 sequences showing up right now. So I'll just look around. So the 8mm concave defect. Apparently that's going to be with me for the rest of my life. It's nothing I can do. No arthroscopic surgery or anything, according to the surgeon. So I went to the surgeon, looked at over all this, and he basically said the indicated procedure would be arthroscopic surgery, and we'll see what needs to be done once we go in there. So it sounded like he didn't really trust the MRI. He didn't outright say that, but he basically said you'll see for sure what's going on in the arthroscopic procedure. Now, I wasn't really sure whether there would be any cutting or sewing, and like there's this this edge of the meniscus there. After several months, it's still loose. It didn't heal, I guess. Same here. And that's on the outside. It's in the red area. I guess, shouldn't that heal? I don't know. I've done a little bit of reading on all this stuff, but so yeah, I don't know. Is there anything else wrong that maybe the guy that analyzed it or girl missed that you guys see? Should I be like wearing a brace constantly? Should I be getting this arthroscopic surgery? Should I only get things sewn up and not cut away? I hear arthroscopic surgery generally is not effective at all. It's just as good to have no surgery or fake surgery. I don't know. Should I look into these stem cells? What should I do? I don't know. I was kind of disappointed with my visit with the doctor because he didn't really have a whole lot to say. He just said arthroscopic surgery, and when I pressed him, would it heal on its own, blah blah blah, he's like, well, you could go and buy a knee brace if you want, and I can write you a prescription. He didn't really say likelihood of it being successful. So he wrote me a prescription for a lateral unloader brace, which would, I guess, my understanding is it pushes on the medial side to unload the lateral side. And I called up a place and they're like $1,600, which I guess is worth it if it's good, but they custom make them, I guess, or custom fit them at least. I don't know. So yeah, here's my MRI. What do you guys think I should do? I guess here's the defect, where I came down very hard, and I gave that. They called it a shallow concave. I don't know, bone marrow edema. Maybe that's this too. That swelling. Irregularity. I don't know. Like, am I gonna get what's the chances I'm gonna be hobbling around with arthritis in like 5 years? Am I screwed? Yeah, I'm gonna stop recording pretty quick, but yeah, let me know what you all think I should do. I really appreciate you guys looking at this. I'll show you the other sequences. So let's look at a few more of these sequences. Looking at that one, let's look at this one. Oh, this one. So it's quite obvious the depression there. I don't know, is that some defect too? And going towards the front. So there's that, and then here. So we're coming through. Let's go back up, see where we are relative to the meniscus. Now that kind of looks like damage on the front side, I forget what you call it, of the meniscus too. If I'm, like, it's not a nice little triangle like you see elsewhere. So I'm not sure why that wasn't mentioned. Is that not an injury? Am I wrong about that? Because when I go to the medial side, which they said was normal, it's nice and triangular. I don't know. Below this. So that's that. There was another one. Well, that's what we were looking at, right? Yeah, I guess this is the pulsation artifact. Is that what I'm seeing? I don't know. So that is it, pretty much. Let me know what you guys think, and I really appreciate it. Thank you very much.